Good morning. Did you know that 80% of the population will suffer back pain at one point in their life? Did you also know that back pain is the leading cause of disability globally today? My name is Dr. Hamisi Kotayani. I'm a chiropractor specialized in fascia manipulation by Steco. I'm also a teacher of fascia manipulation by Steco. And today I would like to address a key lingering problem that a lot of you have been sending us information to address. And this key lingering issue is low back pain, but more specifically, we're going to be looking at disc. Degenerative disc disease affects about 1.4 to 20% of the population. Back pain that radiates down the leg affects between 20% to 40% of the population. But it's also important for you to know that 96% of the population aged above 80% will have disc herniation on MRI, but zero symptom. Also, 37% of people aged between 20 years and above may have positive disc herniation MRIs, but with zero symptoms. So with that said, I would love to take you through what a disc really is first. We need to understand what a disc is and what happens whenever we get a disc herniation. So with me here, I have two visuals that we can use to learn. Visual number one is this plastic skeleton, and visual number two is this disc drawing. I would like to start from the disc drawing, and then we'll move to having it at the disc here. So, if you look at the disc drawing, this is the spine, or rather the vertebral column. This is the vertebral column with the hip, with the pelvic bones. And then we can see the sciatic nerve emerges out, and we can also see some other nerves coming out. And then we can see there are bones. This is called the sacrum bone, or the sitting bone. And then we have this part, this is the disc. And then this is called a vertebra. It's a bone. So between one vertebra and another vertebra, we have a disc. Between one vertebra and another vertebra, we have a disc. And in between the disc and the vertebra, we have a hole that the nerve comes out through. You can also see the nerves also come out from the sitting bone, or rather the sacrum. Now, with this understanding, therefore, we can now be able to move to pick one disc, rather a vertebra and a disc. We just pick it up and put it here, like you can see. And now what we have is we have a vertebra and another vertebra, and then we have a disc, and we have a nerve. And in between, we have the articulation, or the joints that are formed by the two bones. Now, I want us to go a step further and take the two bones and remove them. Like just pull them apart. If we pull them apart like this, what we end up having is this top image, which shows us this cartilage, which is called annulus, and then it shows us this gel, which we call nucleus, and then it shows us this yellow line, which is the nerve, or the spinal nerve, and then of course you can see the vertebra that we have talked about. Now, this is normal. When it's normal like that, it means the two vertebrae sat on each other very well, the disc is there, is not compressed, and the nerve is passing through that hole without any compression. Now, when we develop what we call the degenerative disc disease, the next thing that happens is that because of pressure, because of movement, something is causing the disc to work in an appropriate way, therefore causing more tension or more pressure in one side. And if that happens, then this disc that is supposed to be balanced like this will start either compressing whichever side the pressure is more, or whichever side the pressure is more. So it will be compressing like this or like this. Let's say more like this. So you compress it like this, it will weaken this side. And that is the kind of weakness we can see here. This is not affected, but you can see this one is affected. So it creates a weakness. That weakness creates a bulging. That bulge pushes what? Will push the nerve that comes out of the hole that is left by the two vertebrae. There's a hole here. So as this bulges, it will press on the nerve. So it will press on the nerve. So when the nerve is squeezed, because now the nerve will be strangled by the pressure of the bulging disc, the nerve will start giving you what? Some stiffness, some muscle spasm on the back. It will be the first incident that you get to have a backache. And you go to the hospital and the doctor takes an MRI, takes an X-ray, and you're told, hey, boom, you have a muscle spasm. You have a muscle spasm. That is the beginning of the degeneration. Now, you'll be given some treatment. You'll be given painkillers to calm the situation. You'll be sent for therapy, and that will help to soothe up the nerve a little bit and give you a relief for some time. And then you'll continue with your work. Maybe you even stop the exercise and stop doing the other things. And maybe one day you bend to pick something and you go, or you wake up in the morning and, oh, I can't walk. Why? Because the bulging disc continued bulging because you never addressed the why. You treated the symptoms. You acted on the symptoms. So you continue pushing this. And when it pushes that, that will leak out. It will tear. The bulging now will cause it to tear. And the contents, which is the nucleus, will spill out now to irritate the nerve. When the nerve gets irritated, it will go nuts. When it goes nuts, so it will be irritated, then it will start giving you now what? The leg. It can be you have pain all the way from the buttocks all the way down and numbness on the toes. It can be back behind the leg but doesn't get to the toes. It can only just be sometimes on the buttocks. People tell you, I feel my pain here. So you can either get it the whole way, or you can get it here, half. You can get it half. You can get it the whole way. I can get it all the way to the feet. Depends on how much compression, how much severity is here. You can also get some other that goes in all the way, depending on where the disc is what? It's compressed. Because the disc can be compressed at what we call L4. L4 is nothing serious. It's just 1, 2, 3, 4 going down. L4 is here. So this is the nerve that is being, this is the nerve that is being what? Compressed. This one is the nerve that is being compressed. So when that nerve is compressed, this will be the presentation. It will give you pain here because this is the nerve root supply for that. It will give you pain on the back, and sometimes it can give you pain all the way to the big toe. Then it can also be compressed here on root number 5. If it is given at root number 5, the presentation is different. It comes to the web of the foot. It also comes down and disappears somewhere, but emerges, and you know that is number 5. It can also affect lower at S1. And in the S1, it is either going all the way down, or it has a little bit in the calf and a little bit there. Those are the 3 main leg distribution of pain, being nerve number 4, nerve number 5, and nerve S1. That is how the disc bulges. Now, I want to show you that here. I have with me a plastic visual. This is the skull with the head. And then from the head, we have the neck. Then we have what we call the thoracic spine. We have the lumbar spine. And then we have the sacrum. And then these are the pelvic bones. This is called the femur or the leg bone, the thigh bone. Then you have the patella. You have the tibia and the fibula. Here there are 2 bones. And then you have all your bones of the foot. And then you have the rib cage, you have your arm bone, you have 2 bones at the arm, and you have your bones of the hand. Okay, so today's interest is to look at a disc herniation, especially between L4, L5, S1. So L4, where you see the red, this is L4. There's this nerve root. It is this nerve root. Its presentation is what I've shown you right here. It brings pain to the medial knee and it brings pain to the big thumb, to the big toe. It can be compressed when the bulging on the disc bulges, like you can see in the red stuff, and it compresses on the nerve here. So the nerve, as it comes down the buttock, down to supply the knee and go down, to give us the presentation of the pain, okay? Then there is number 5. The nerve number 5 is the one below it. If again it's compressed, it will give us the same presentation. And then here is S1. It's called S1 is because it's between the sacrum and the lumbar spine. So it's called S because of sacrum. So the nerve, this one that comes out of here, can be compressed here when this vertebra slides forward or backward. It can slide. When it slides, it causes something called spasticity, and again, it will cause a leg pain compression. With that said, we need to understand then what is this that causes the tension of the body to pull one side or to overwork one side.